Welcome to the Healing Grove podcast. I'm Dr. Kristin Ryman, an integrative holistic family physician, author of Life After Lyme, and host in this virtual space of learning, healing, and growing. I believe humans are like trees, and our physical limb is only one of many. Health on all limbs of the tree, emotional, conceptual, social, spiritual, is absolutely required for the whole tree that is you to be vibrantly well. I created the Healing Grove podcast as a place to showcase some of the world's best integrative and holistic medicine, to expose you to transformative tools and mindset shifts for all limbs of your tree. I hope you enjoy our conversation in the Healing Grove today as much as I enjoyed having it. Hey everyone, welcome back to the Healing Grove podcast. My guest today is Dr. Kelley, MD. She is the founder and medical director of Case Integrative Health in Chicago, Illinois. But in the process of earning her medical degree at Ohio State, she became herself increasingly ill. She had extreme fatigue, difficulty breathing, dizziness, all sorts of symptoms. And we'll get into that in her story when she tells it. And doctors were assuring her at the time that her health issues were not anything other than stress, but she knew something else was going on. So she kept looking for a root, and eventually she found the root and was able to get a correct diagnoses really, which she's going to tell us about. And after treatment, she's now been in remission for more than 15 years. Super amazing, and can't wait to hear you share that story with this audience. What you learned and really who you've become through that has really resulted in you're being able to help so many other people, Dr. Kelley, and you're going to tell us about what you do at Case Integrative in a minute. There you serve patients of all ages from all over the country and help them get to the root cause of their chronic illness, transforming their health through functional medicine. And I think you were one of the first physicians who actually became double board certified in both your specialty, which is family medicine like mine, and integrative medicine. Is that right, Dr. Kelley?
Yeah, I was in the first couple years of providers who went all the way through and got that board certification. Yeah.
Did you do the thing so I did the thing where I got grandfathered in because, yeah, you did also.
I did too. Yeah.
So we're probably in a similar cohort. That's awesome.
Yeah.
So last thing I'll say is, you've been lecturing all over the place. I heard you, I think at ILADS last year, and just sharing information is kind of one of your special passions. So I can't wait for you to share some of that with us today. Thanks for being here.
Well, thank you for having me. I'm really excited.
Cool. Well, let's get started by you kind of walking us through what the heck happened.
Yeah. It actually started a little bit prior to med school. It started in college. And I was very active in high school. I did track and show choir and dance and all kinds of things. And then in college, I stopped being able to do all the things. And my dorm was on the top of a hill. And by the time I got up to the hill, I would be so drained and winded and short of breath and just awful. And I would take these huge naps. And I chalked it up to college. It's a different course load. It's a different thing, whatever. Eventually, I actually got diagnosed with asthma because that shortness of breath was some of my biggest symptoms, but that just never really fit. I wasn't wheezing, and albuterol didn't help at all. So but I kept just kind of pushing through and going and figured, it is what it is. And so I moved along, and in med school, the course load gets even more, right? And the hours get even more, and the symptoms got even more. Dizziness when I stood up, inability to concentrate and focus, fatigue, debilitating fatigue. I just hated standing up. Every time I stood up, I just felt sick, and I felt like I was running a marathon all day. Tachycardia, my heart was racing, and I was just sitting, and it made it really hard to try to learn school when I couldn't focus and pay attention. And I do what a lot of med students do. They read about things and they think, oh, I have that. That must be it, right? And I read about POTS, Postural Orthostatic Tachycardia syndrome. And I said, actually, that sounds right. So I went to the doctor and I told him what I thought it was and asked him for all the tests. And I did a tilt table study, which I don't know if you've ever experienced or saw or did in your training, but it was a miserable test. I kind of call it the Hannibal Lecter test. They strap you to a bed and they, quickly invert the bed so you're standing up, kind of like Hannibal Lecter on the sheet, and monitor your vital signs and see, if you pass out or not, or if you throw up, or if your heart rate increases, your blood pressure drops just within certain shifts or certain areas. And it was miserable. And then they give you basically adrenaline and do it again and make it worse. It was great fun. Yeah. So that's how I was formally actually diagnosed with POTS. And I tried many different medications to help with those symptoms, and nothing helped really. I tried fludrocortisone, I tried SSRIs. By the time I was in residency, I was on a beta blocker to help kind of calm that heart rate and slow that down. But I was also on an alpha agonist to bring my blood pressure up. So those two kind of compete a little bit. And, during 30-hour shifts and all that nonsense, it was hard. It was really, really, really hard. And I was miserable and I almost quit. It was hard. It was just exhausting and draining and hard.
Where were you when you hit that point where you were about ready to quit? Like, how far into it were you?
I was almost done with residency.
Wow.
I was toward the very end of residency, and that's how bad it was that I, had made it 6 or 7 years into my 7-year training and was about to throw in the towel.
Wow. Okay. So let's
Yeah.
before you go on, I really want to hear a little bit more about what the process looked like with that diagnosis and treatment. You talked about the tilt table test and you talked about some of the treatments. Was anyone talking about why?
Not at all. Not at that point. No. I went to school in Ohio, and there is a doctor in Ohio who was doing research on POTS. He was actually at Toledo. And I was doing my own research on it. And a lot of the research at the time was more viral in nature. So an Epstein-Barr or cytomegalovirus, some sort of viral inciting incident for it. But there really wasn't a treatment to treat the cause. It was all symptomatic support. And, compression stockings, salt water, put your legs up, try these different medications, all just symptomatic support.
Yeah. So,
Yeah.
okay. So we're gonna get into what you finally did that helped. But before we do, I don't know the answer to this. I'm wondering if you do. Have you ever seen those things actually resolve POTS?
No,
Yeah, me neither.
no, no. They were a Band-Aid. And for me, it did help me through that really tough time, especially with the hours that I was working and things that kind of helped make it at least a little more manageable, but it didn't fix anything.
Yeah. And for those listening who are still trying to understand why these symptoms come from POTS, essentially your blood pressure and your heart rate can't keep up with changes in posture. They can't modulate appropriately so that your blood pressure increases when you stand up, so that your heart can still get oxygen and blood to your brain, and you can become very dizzy. I've never had a tilt test. I now understand why Hannibal Lecter was so grumpy and dysregulated. But I want to know, how would you explain to people what happens in your brain when you are not allowed to, like when they tilt you up and they're in control of your process? Because a lot of people with POTS, when they stand up, they get dizzy, they put their head down, and that can be a Band-Aid, right? That can help bring blood flow. What happens when you're strapped to a table?
Yeah. For me, my heart rate went through the roof and I got really nauseous and nauseated and almost threw up. And often people will actually pass out on the test. Yeah. Yeah. They tried to monitor that and drop you down before, but yeah, actually passing out would be considered a positive test. It's almost like they want you to pass out.
Because it demonstrates that you are not capable of changing your position. Yeah.
Exactly. Yeah.
Wow. Okay. Please continue.
Yeah, the way I will describe it to people too is a normal functioning body. You don't even notice when you stand up because your heart rate and your blood pressure accommodate for that shift in gravity and that change. And so you just go on like you don't even think about it. A lot of people have had that feeling though before where they stood up too fast and they get dizzy. It's just that all the time. And it's a dysfunction of the autonomic nervous system, that fight or flight, those kind of parts of our system that we don't have to think about. We don't have to think about, generally speaking, our heart rate or our breathing, our digestion. These things just happen for us, and our nervous system, our autonomic nervous system, helps to regulate that. And so this is a dysfunction of that autonomic nervous system. It's interesting because it's also kind of tricky to find experts in this, because I actually ended up seeing an endocrinologist at one point who had some specialties, but neurologists or cardiologists. So, so there's kind of multiple different specialists who will look at this, but there's not a lot. You have to find them. They're definitely more specialized care for that autonomic dysfunction. And it's a spectrum. So there's some people with severe POTS. I know people with POTS who have service dogs and service animals to help alert them when they need to sit, and or who can't, sit at all. They're in a wheelchair, they can't go out and function. And other people who it happens more sporadically. So it's definitely a spectrum.
So at the end of the day, if you had your choice now, looking back, would you have gone to some of those very specialized neurologists and endocrinologists and cardiologists first, or would you have gone straight to functional medicine?
Oh, I would have gone straight to functional medicine.
So tell us how you got there. How'd you finally get there?
So for my personal journey into integrative and functional medicine actually started in med school. I started to see, we were very big on diagnosing illnesses. We were very big on giving medications. We were very big on giving medications for the side effects of the first medication that we gave. But to me, there was a lack of curiosity for the underlying root cause. What's happening here? What's that underlying root? And I went to school at Ohio State, who now has an integrative medicine department, if you will, but they had at least a doctor there who was into nutrition. And so I was able to learn about that a little bit. In residency, I found the American Holistic Medical Association. This is where I get grandfathered in, right? Because that's not even around anymore. But that was when did that start? In the 70s, 80s with Phyllis and Gary?
Yeah, it was back there.
Yeah. So I went to my first AHMA conference and saw that there were other providers, there's other physicians who were curious and thinking about that and looking at the body as a whole and trying to put it all together and think about all the ins and outs. And from there, I found functional medicine as well. And my big gift to myself after residency was to go to the functional medicine week-long course and dive into that and start learning about that and all of the science and the research and the data behind the system and the body working as a whole. When I first kind of got into it, there was I was called the voodoo doc in my residency. What vitamin are they are they deficient in, Dr. Kelley? They've got scurvy, so maybe it's vitamin C. These things are real. But I didn't let it faze me, right? Because I knew there was more to it. Like there's more to this, and it's not just about, prescribing medications. And so my personal journey led me to that. And in that functional medicine world, actually, I started to hear Dr. Horowitz speak, and he talked about POTS, and he talked about POTS with Bartonella and Lyme. And I was, hold up, that's a whole new can of worms. I know doctors lose their license for treating Lyme. That's scary. I don't think I'm like, la, la, la. I don't know. I don't want to know about it. But it kept coming up. It kept coming up. Said, okay, fine, universe, I hear you. I'll get tested. I don't remember having a tick bite. I don't remember having a bullseye rash. I grew up running around my neighborhood barefoot. I went to summer camp in the middle of the woods. My mom had chronic fatigue syndrome, and we don't know why she had it. And who knows where this came about in my life. I don't know exactly when or where. It was probably there since childhood, or if not, prior, and just kind of slowly progressed over time in my system. But I got myself tested, and lo and behold, there was Lyme, BBC, and BART. So the kind of the holy on Trinity, or there.
Yeah, the three baddies all at once.
Yeah. And through that journey is how the POTS healed, treating those infections and clearing that and healing my adrenals and healing my gut and doing all of that work is really where the POTS went away.
Wow. So now that I know about your mom having a chronic fatiguing illness, I wonder about congenital transmission for you. And then I'm like, but wow, you were so seemingly healthy as a child. You were such a badass, and you were doing all these things, including show choir, which is news for me. And I want to hear more about that. Maybe. But do you looking back at your childhood, do you see little glitches where you're like, actually, I wasn't all that because I had, terrible allergies, or I had chronic knee pain, or like, are there any hints?
No, no, I was a really healthy kid, and I grew up Midwest Ohio, not good healthy diet. I mean, I wasn't doing myself any favors with my bologna sandwiches and Doritos, Little Debbie's growing up. But I was very active. I was top in my classes, and I, didn't have any big setbacks until I started to not be able to walk up the hill to
Yeah.
my dorm. Yeah.
I'm curious, since you mentioned Dr. Horowitz, did you take his MSIDS questionnaire kind of prior to treatment or around the time you were getting diagnosed?
Good question. I think I did. I don't remember my score or what I did, but I remember doing it. It was probably so off the charts. I was just, forget it.
Yeah.
It's clearly a positive. Yeah. Yeah.
Yeah, for those who don't know about it, it's a really helpful assessment tool to help sort of decide or help you decide whether to pursue a diagnosis or maybe even a practitioner of a tick-borne infection, because it kind of it kind of gives
Mhm.
you three options of like very low likelihood based on your symptoms that you have a tick-borne infection, moderate likelihood, and high
Mhm.
likelihood. My guess is with all those symptoms, you were high
Mhm.
likelihood at that
Yeah.
point.
Yeah.
Yeah,
Yeah. And it is a scientifically validated questionnaire. He has done some work on that. So I do find it a very useful tool as
yeah,
a screening
it's a good
test. Yeah.
starting place for people who are like,
Mhm.
could this be Lyme or a tick-borne infection? Yeah, wow. So you had the big three. So what happened next?
Well, this is one of those hindsight things. I probably would have sought out a Lyme literate doc and gotten treatment, but instead I decided to treat myself, for better or for worse, right? But I actually, I learn a lot when I do that. And I kind of like being my own guinea pig and trying things out. So I started off with different antibiotics and I started treating it. Then my mouth broke out in all these ulcers, and so I decided I was done. So I switched to herbs and I started working with an herbalist and got some different herbs. And that, the medicine got me to a certain level, the herbs got me to a certain level, but then I went and did some pretty intensive nutritional IV therapies, including ozone. And that's when things really started to turn around for me.
Yeah,
Was with
and for people who
MSIDS.
aren't familiar with IV ozone, can you give us kind of just in a nutshell, like what's the whole process?
Yeah, absolutely. I love ozone. So I'll give you my little spiel that I kind of give to patients when they come in. Ozone is a gas. It is 3 O's instead of 2. 2 is what we breathe. If we hear ozone, we think the ozone layer, it's toxic. Yeah, you don't want to breathe it. That's when it's bad. But it's actually a naturally occurring part of our body. It's a reactive oxygen species. Our antibodies make ozone to help fight off infections. So those infections can't make antioxidants. They can't fight that off, but your cells can. So the ozone treatment, we take blood out of the body, and into that blood, we put ozone gas. As soon as that gas touches the blood, the vast majority of it turns to oxygen. That's your healing source. That's your fuel source. Most infections, cancers, et cetera, hate all that extra oxygen to help them kind of turn on your cells. But the real magic happens when the rest of the ozone that forms ozonides. I think of them as little on switches that turn your system on. So you make more antioxidants. You help your blood flow better. You help yourself detox better. It will kill anything that's in that blood. Ozone is a sterilizer. It's used to sterilize ORs and things in other countries. A lot of the chronic infections that we have, though, are not necessarily just floating around in our blood. They're in our tissues. So ozone, though, works by helping to turn on your immune system so it can better fight the infections for you. It has anti-cancer, anti-aging properties to it as well, which is always a bonus. The blood goes back. In our clinic, we also use UV light. It goes through UV light, which helps. It's synergistic. It works better with the ozone, in my opinion. And then you get all the blood back and all the goodness back. And it's safer than aspirin. It's a wonderful option for people to help accelerate their treatment. Is it right for everybody? No. Does it help everybody? No. But does it help a lot of people? Yeah. Yeah, it really does.
Who is it not right for, in your opinion?
So one of the big contraindications is something called a G6PD deficiency, which, that enzyme allows you to tolerate oxidative stress. So the ozone is creating some oxidative stress, just like exercise is creating oxidative stress. So, but people who have some genetic issues or other reasons why they can't tolerate oxidative stress, this may not be the right treatment for them. There are a couple others like overt hyperthyroidism. You probably don't want to use ozone. And I also find that if you have a babesia treatment that you are not actively or infection, excuse me, that you are not actively treating, ozone tends to cause more herxing in those patients and die-off reactions because Babesia lives in the red blood cells. So if we're treating the red blood cells and we're killing Babesia, that tends to cause more issues if it's not actively being treated and monitored. So if I have someone who I don't know has a Babesia infection and we give them ozone and they feel really bad, then I have to look for Babesia in a different way and make sure that that's not the culprit.
Okay, I might be a little confused there. I heard you say that the blood is outside of the body when it's being treated.
Yeah, we take blood into an IV bag and
Uh-huh.
put the gas in the blood and put the blood back in the body. So it's a
So
closed loop.
how does the herxing get back into the patient if it goes through the UV process after that?
So it's a killing off of the infection. That killing creates the immune reaction to it. So if we have a body burden in your blood cells and we kill off the Babesia and we've got all these broken Babesia fragments now in your blood, you're going to create a cytokine reaction to those Babesia fragments. That's really,
For
in my
sure.
opinion, a lot of what the Herxheimer is.
Yeah, but that's in the body. I understand that. My question is, if the killing of the Babesia or whatever else you're killing with ozone happens outside of the body in a bag,
Mhm.
why does that then impact the body? It's not in the body in that moment. The blood comes back. Are the cytokines and things that got released in the bag still in the tube when it comes back into your body?
Well, there's two parts. So you may have some localized reactions to it with the cytokines, but also again, you're kind of getting those fragments. It's almost like you're getting, in a sense, a vaccine in a way, like you're getting those proteins from the Babesia broken up back into your system. So your
Gotcha.
immune system can react to that, which is a good thing, right? Because now your immune system is going to react to all the little tiny pieces parts. So it actually gives you an opportunity to make more antibodies possibly than you could maybe even when it was the full thing and connected in its biofilm and all this other gunk.
Yeah.
So when those come back, that tends to create a reaction.
That makes a lot of sense. You're basically you're killing the things outside the body, bringing the fragments back in, and those fragments now become like a dead version of the bug that the immune system can react to. So the herc still happens. Got
Yeah.
it. Oh,
Yeah.
interesting.
But I typically, and I don't have any testing to prove this one way or another, but clinically I can speak to, we usually only see that kind of a thing with Babesia. With the other infections, it tends to help with the Herxheimers and limit that and calm it down. Actually, if people come in are having big Herxheimer reactions, sometimes we'll use ozone to help calm it down. So it's more of that like unchecked or unknown Babesia issue where I will see that.
Gotcha.
Yeah.
So interesting.
Yeah.
So tell me a little bit more about the UVB that's happening too on its way back in. I'm curious about that.
Yeah, it's actually, there was one study and I can find it for you, but it accelerates the UV's benefits by 6 to 7%. And there are clinics out there that just use ultraviolet light, and ours uses UVA, B, C. I think it's a combination of them, but it just the tubing simply goes through the lights on its way back into your arm. UV light is used for, oh gosh, what's the cancer? There's a dermatological cancer.
Is it Epstein-Barr? Is it the Kaposi's?
Oh,
Is
shoot.
it? Yeah, it's in the tip of
Yeah,
my.
we might have to look that up, put in the show notes, but it is used for a cancer therapy. UV light's also used for like psoriasis and things too. So we do use UV light therapeutically for other things in the US, and it's just really amplification. And a lot of it, I think, comes down to, again, kind of breaking up the bacterias and things and creating kind of this vaccine type of reaction to allow your immune system to better help you fight off these chronic infections.
Very interesting. I love that you're using them synergistically. I'd never heard of anyone doing that before. That's really very cool. Okay, so let's get back into your journey a little bit. So you were on the herbs, you got better and better. At what point did you attain your current rock star status?
I have to look. I don't, because I just don't keep track of it because I don't think about it in those terms necessarily. It's definitely been a journey. I will say, from my first child who's 7 to my second who's 7 months, that journey, those last 7 years have been continuing to progress and get better and healthier and healthier. And I know I felt healthy enough and strong enough to get pregnant before the first child, because I wanted to do my very best to make sure I was as healthy as possible, to protect her from anything that may be going on. And so probably 8 to 10 years ago is where I started to really, really kind of clock in and feel like, I think this is gone. Like my POTS is gone. I'm on, bare maintenance, supplemental support, feeling good. Yeah. So, but it took a while. I mean, it was a good 8 to 10 years to get to that point.
Yeah.
Yeah.
It's a long road. So
Mm-hmm.
are you willing to talk a little bit about what it was like to choose to become pregnant, given that you still weren't well yet? You felt well enough to do it.
Mm-hmm.
Were there any sort of learnings from that were unexpected?
I think that for me, remission is a better word than cure for these chronic illnesses. I kind of think of them like chicken pox. Once you get chicken pox, you don't really get rid of chicken pox, but my chicken pox is in a little box and not bothering me. I don't have shingles right now, knock on wood, right? So, I can kind of learn to coexist with these things. And I want to try to eradicate as much of it as humanly possible. But I also think focusing on getting rid of every single last spirochete bacteria from my system is futile. And that's not where I want to spend my energy. I want to spend my energy on thanking my immune system and loving my immune system and keep prepping, pumping that up and making sure that my immune system is doing what it needs to keep it all in balance. And it sounds silly sometimes, but I'll talk to these critters and say, you can stay if you're good. If you're here to just hang out and cause me no harm, you are welcome to stay. Otherwise, you need to get out. Like, we're good, right? Leave the
Like
system.
talking to teenagers.
I don't have teenagers yet, but I'll take your word for it. Yeah.
So were there special considerations for you while you were pregnant? I mean, given that you believe they were still there, were you doing things to kind of prevent transmission?
Yeah, I personally chose to do herbs. So I worked with an herbalist and I took pregnancy safe herbs just because of how I had reacted to the antibiotics in the past. So I, wanted to and I recommend this for my pregnant moms today, even if you don't feel sick, we don't know. There's not enough data about chronic Lyme and transmission and chronic babesia, et cetera. A lot of the research is lacking, period, full stop, but a lot of it's on acute infections, not these chronic infections. So we just don't know exactly what those risks are. So if we can do things that are safe for pregnancy and help reduce that risk, I think we should. So for myself, I chose to go with herbs during pregnancy, and I felt wonderful during my pregnancies. And I think a lot of that too is the immune system changes when you're pregnant, because you've got this little parasite growing in your womb and your immune system has to change so that it supports it. It doesn't kick it out. And so for a lot of Lyme patients, our symptoms are our immune system that's on hyperdrive. And so when the immune system calms down, you feel better. So I have a lot of moms who feel really, really pretty darn good during pregnancy because of that. That's not universal, unfortunately. But yeah, so for me, it was, what can I do to help prep my system? What can I do to help stay on something, during that process to help reduce that risk? And then what do I need to do anything after to make sure she's okay?
Will you walk us through those things?
Yeah. Well, for me, so it was, the whole journey ahead of time of antibiotics, herbs, IVs, and I mentioned briefly too, adrenal support, gut support. I mean, that whole functional approach to getting my system back in order, not working 30-hour shifts anymore helped an awful lot, getting better sleep, moving, like all of that work was done. And it personally was not done just so I could have a baby. It was done so I could get healthy. Right. But I knew that I needed to do that in order to feel like I could even and not even just carry the baby, but take care of the baby afterwards. Because that's a lot of work and that's exhausting and you're not sleeping and you're doing all those things. And then, the prep work of, and I think IVs are great. Like Ozone is a wonderful preparatory thing to do to make sure that your system is clean and ready. And then herbs or medications or pregnancy safe medications that you could take as well during pregnancy, depending on what infections you have. And then, eating right, trying to exercise as well, sleep right, trying to do all the other lifestyle things to keep yourself as healthy as possible during pregnancy. And then afterwards, I chose to breastfeed. And so I continued those things throughout breastfeeding. Just did everything I could to make sure that I was creating an environment for the baby that was good and healthy. And then, just kind of kept an eye on her afterwards. And thank goodness both of my kids are great. wonderful, healthy little kids. So, but I give them all kinds of vitamins and supplements and fun stuff. So
Right.
they're
You got it covered. I'm really glad to hear they're doing fine. It sounds like you did everything. So a lot of doctors, when I trained with iLads, they were recommending send off the placenta, send off some of the, the foreskin for microscopy and for culture and for genetics and all the things to IGenics. Did you do that stuff for your pregnancies? Send off bits and pieces for testing?
I did not, and I think it's a really personal choice. So here's kind of how I will describe it to other moms. I'm like, what do you want to do with that information? Knowledge is power, but also sometimes it's not. So what does that information mean to you if the baby's healthy? What does that information mean to you if the baby's not? Where are you with that? What do you want to know? And what are you going to do? Let's say if you have a healthy baby and it's positive, like what are you going to do with that? Right? Is that going to change how you interact with babies? Is it going to change what you do? Like, I need mom and dad to think through all of that information and do what's right for them and what makes sense to them. And I think it's a very, very personal, individualized question for the family to answer. There's not a great, congenital Lyme picture either, unfortunately. So like congenital syphilis, we kind of know, what to look out for, but we don't with Lyme. It's very gray and arbitrary and has not been studied well at all. So, what are you going to do? And I think a lot of functional medicine, for kids is also useful tools, and, keeping them healthy and making sure they're on the right foods and, what nutrients do they need, and like individually treating them, I think is helpful too. So very personalized answer for that.
Yeah, I love it. It's emblematic of, I think, how we approach things as family doctors. It's relationship centered, it's patient centered, it's all about like values and, belief systems and how it's going to change your management, really.
Yeah.
Love that you're having those conversations. So, are there people you've seen who've had, do you follow any kids in your practice who were born with congenital Lyme and Babesia and all the things? Like, can you give us some kind of snapshots of what that might look like? Because I think a lot of people, similar to POTS, there are a lot of diagnoses of early childhood and even late childhood that people kind of normalize. And they're like, oh, they just have blank, it comes from nowhere. It's just part of, talk to us about that. Because I think you might have some perspective on that.
Yeah. Unfortunately, I just don't think our testing is good enough for me to be able to like definitively say somebody has congenital Lyme versus not. And I mean, I have entire families. I have, a family of 8, for example, and they almost all have Lyme, but I don't know if it's because they all got it from mom or because they all live in the same place and go camping in the same place and have gotten exposed to the same bugs, and there's not a test for me to be able to prove definitively one way or another, necessarily, if a kid's sick and there's testing done, there are some ways, but even that, like our testing is just so crummy for these things.
Well,
It's
sometimes
hard to say.
we're retrospectively saying, wow, it must have been Lyme because we treated it for Lyme and it got better.
Yeah. Yeah. But, again, there's not this like, and there's also not this perfect, well, you have congenital Lyme if you have these 5 symptoms.
Right.
That doesn't exist, unfortunately. And a lot of the Lyme, congenital Lyme, or even just like normal Lyme symptoms, they overlap. They're the exact same thing. It's fatigue, it's low stamina, it's focus issues, it's joint pain and swelling. So it's kind of hard to differentiate that, the acute Lyme, chronic Lyme, congenital Lyme. There's not a great marker for it.
But I think for people to hear that, a lot of people will normalize their child's fatigue, normalize their child, they'll call it laziness. He's just lazy. I don't know about you, but I don't really believe kids are lazy. Like kids are like, they're programmed to explore and learn and devour the world. So if your kid is not showing up in that way, there's probably something going on that we should be looking for. And in my experience, often some of these infections are at the root. Once you clean up diet, once you make sure they're not living in mold, once you make sure they're in a reaction to a medication or a shot, like often there's Lyme.
Often there is, yeah. And if mom has it, there's definitely some links and implications there. The biggest things again with kids, and it's hard with kids too, because they can't speak, they can't say the words the way that, maybe an adult can to describe what they're feeling. But if you're noticing, and first of all, yes, I see a ton of kids here. We see a ton of kids at our practice. And there's other providers, thank goodness, in our area who are looking for these things, and not just chalking it up and saying, oh, it's just the lazy kid or what have you. But yeah, fatigue is kind of one of the biggest ones, symptoms that these kids will have, and it's low stamina as well. So it's, they can't keep up with the other kids on the playground. They're just not able to do all the things they have to, maybe nap until older ages than their other kids are still, or they're taking 2 naps when they should be 1 or what have you. That can be part of it as well. Joint pain is another one as well. And a lot of that will often be called growing pains, and I'm not sure if it's growing pains or if it's something else, especially in the picture with multiple other symptoms. Some of these kids will also just have like recurring fevers. They get sick a lot, or it's not even that they're sick with other stuff or no one else in the family is sick, but they just get these recurring fevers periodically. So it's another one to look out for.
Yeah. Yeah. I'm thinking a lot about now, as you're mentioning the growing pains. I mean, I remember thinking this as a child, like, why do my knees hurt when I grow? No one else seems to be hurting from growing. And looking back now, I'm wondering if my Lyme was actually I sort of was, in retrospect, I was chalking it up to, well, I was eating a lot of gluten, and now gluten definitely makes my joints hurt. So maybe that was it, but who knows? Some of it we'll never know, right?
Right. Yeah.
So tell me a little bit more about how people could work with you if they wanted to come see you as a patient.
Absolutely. Yeah. So going to our website is a great place to start. So Case Integrative Health, and we see patients from all over the world, really. We have international patients as well. We do need to see people in person though, especially to establish care, and get that going. I have 2 physician assistants that work with me as well. We also have other doctors in our clinic. So it's not just Lyme and chronic disease. We have a cardiologist. We also have a longevity and hormone expert, and we have a pain specialist too. So, we have other things that we are trying to approach and work with, and not just the chronic mysterious illness world. That's my particular practice, but the practice as a whole is really just trying to kind of look at the different aspects of health and healing and what's going on, and trying to find that root cause of why. Yeah.
Amazing. Well, before we finish, is there anything else that you would like to share with this audience of wellness seekers looking for tips and tools, and maybe even just education and information that might change their world for the better?
Yeah, I think a couple things to remember is, one, this is a marathon. Healing is a marathon, and it's not always linear. It's very up and down. And part of that process is kind of succumbing to that and understanding that you're going to have good days and bad days, and kind of creating little mini goals. And so, when I ask people, what does it mean to feel better? Sometimes that's kind of hard to actually vocalize until you sit and really think with it. For some people, it's being able to read books again. For other people, it's being able to actually run a marathon. What is that like to you, and how do we get you there, and how can we create these like little mini goals so we can show like, hey, like you are getting better. Fatigue, for example, you can just feel just as tired at the end of the day, when you're getting in the process of getting better, but you were able to do 17 things that day instead of 5. That's a huge increase and a huge benefit, right? So it's about looking at it a little different. It's about talking to yourself and loving to yourself and your immune system and your nervous system, and working through that process, and being an advocate for yourself, and not being okay with just your labs are normal. Go see a psychiatrist. Unfortunately, I hear that way too often from patients in my practice. And if you don't feel like it's right, if something is going on, keep looking for that provider who will listen to you and who will hear you and take the time to help you figure it out. Because we exist, we are out there, and you have to find that right connection and that right person to support you, and be your own advocate. Yeah.
Wonderful words. Thank you so much, Dr. Kelley. This has been really, really beautiful. And I'm so grateful for all the work that you're doing, both at the national level with ILADS and in your clinic with patients one-on-one.
Thank you. Yeah. Thank you for having me.
I hope you enjoyed this episode of the Healing Grove podcast. If you liked it, please be sure to like and subscribe. And if you want to deepen your experience further, consider grabbing a copy of the Healing Grove Playbook. With journal prompts for this podcast and 41 others, it's the perfect place to record your learnings, keep track of the tools you explore, and reflect on your own experience. Finally, it's important to mention that even though I am a doctor, nothing you hear on this podcast, whether from myself or my guests, constitutes medical advice. Any intervention you try should always be discussed with and supervised by a trusted member of your own healing team. Thanks for listening, and see you next time in the Healing Grove.